Welcome once again, ladies and gentlemen, to another episode of the Think Clinical podcast. My name is Hamza. It's great to be here as always, and I appreciate all the support and everything that you do for the channel. Today, once again, we will be continuing from our episode from last week, where we started outlining some of the challenges that we have in the government hospitals and the government healthcare institutions in Africa, and just how those challenges are translating and continuously deteriorating as far as the quality of healthcare that we provide is concerned, and as far as the long-term financial and operational sustainability of these hospitals are concerned. So welcome once again, and as I said last week, a lot of this conversation is going to be centered around just brainstorming on ideas and strategies that we could be looking at in the context of a government hospital that at least with some form of entrepreneurial mindset, we could be able to improve how sustainable and how less reliant these hospitals would be on external funding. So this is going to be another very important brainstorming exercise. I will be presenting with my thoughts on how certain things can be done more efficiently, and if you have any comments or any suggestions concerning these conversations, please leave in the comment section. I'll be happy to engage you. We'll be happy to have that conversation at different points of this. But welcome once again, and if you haven't done so already, please subscribe, like, and share. We are happy to provide all the information that will be needed as far as this topic is concerned. So now, just to open up this conversation on a brighter note, or on a more positive note, we need to acknowledge the fact that a lot of hospitals and government hospitals across Africa are doing things that are very innovative and really positioning these hospitals to be able to do a lot more with very, very little resources and very little available. The biggest recommendation here is the ability of these hospitals to actually explore more and different innovative strategies that they'll be able to use to amplify the impact of the resources they have, to efficiently use the resources they have. So if they don't have enough people, enough human resource, these hospitals have really stepped up with very innovative ways of making sure that the hospital keeps running and is actually maintaining a certain level of quality. If there are no medical equipment or infrastructure that will be able to help with diagnostics, these hospitals have stepped up in so many different ways to be able to create partnerships that have made these available. So the bright side of this conversation is that there's a lot of effort to become more innovative internally, especially in teaching hospital settings, to be able to make and generate more income and actually be able to do more with less. So that's a very important thing. The difficulty I had in putting all this together is the fact that financial and operational information of hospitals is not really readily available, especially after COVID. So for those that I was able to look into, and I'm still actually doing a very deep dive into some of the financial and operational issues of some of these hospitals that I got access to. Most of them, the most up-to-date information that you may get comprehensively ends somewhere in 2018 or 2019. So after COVID, most hospitals have really not reported what has been happening within the hospital. So it's been a challenge getting the right kind of information to make a more informed suggestion as far as how this can become more sustainable in the long term. But with the information available, I will attempt to offer some insight into what I think can be done in this context to make us more efficient. Now, one of the biggest things that we need to really look at is the fact that these hospitals and these institutions have all the frameworks properly laid out. There's a need, and they've identified the need to have all the different services and departments very well laid out. There is a very well structured management structure that provides leadership at different levels within most of the settings, whether it's a primary healthcare setting, a secondary or tertiary, or a quaternary service. The government, the Ministry of Health and the health services have been able to really define how each unit should be able to work and provide leadership at different levels, which is one of the most important things and the first thing I want to talk about. That before we can actually think about transforming the financial, operational health of any government hospital, we need to have the infrastructure in place to clearly define how leadership is going to look like depending on where or the level of care that is provided. Now, the tendency of these things when you do a deep dive is the fact that a lot of these different leadership levels may not be necessary. And I say may not be necessary because it ends up having too many people and too many hands in the pot, and that actually delays a lot of decision-making processes. Secondly, we do not need to have people in positions just because they need to be there. We need to be sure that those positions that we are giving out to these people is going to fulfill a specific function. So in as much as it's important for us to have different levels of leadership and to make sure that we are able to filter issues and challenges at different levels and fix them at different levels and escalate if need be, we also need to take a holistic look at how these leadership levels are structured, and just understanding that it may not be giving us the full value of what we need because some of these leadership or some of these roles have to be eliminated. And eliminating these roles reduces just the bureaucracy of the number of people that issues need to go through before they actually get the attention they need and the solution they need. I'll give you an example. If we have a typical nursing setting where I'll use a doctor setting for instance, and I mean that would be because I'm part of that team. If as a junior doctor I have a problem, let's say I just started working, I've started my medical career, I'm in my first 2 years as a houseman. If I have any issues, the first people I go to is my immediate supervisor, which is possibly going to be a resident. In some cases, you will be working directly with your consultant or the head of the team. So you have different teams within the setup that manage the clinical care. Now, once those issues are discussed within a team, now if there's no solution to those issues, now the team lead is now going to escalate it to the departmental level. At the departmental level, if there's no solution to it, then it goes into a directorate level, and then it keeps going up in different positions. What we need to be sure about, and again, I'm not prescribing any immediate solutions here, but what I am proposing is a second look at the level of bureaucracy that we need to go through to be able to fix issues. There should be redefining of those roles and still have multiple levels of leadership with clearly some boundaries eliminated. Because once an issue gets into the hands of a leadership position, and I use leadership very carefully, and no action is taken at that level, it literally cripples whatever the issue is and keeps it at that level until somebody decides to move forward. So the first thing for any government institution in Africa and all over the world and in any institution is leadership. And the ability to structure this leadership in such a way that at every level it provides value and it provides efficiency is one of the first things that we need to look at within these government institutions. If you have to go through 1,000 people to get, let's say, a letter of recommendation from the hospital for something, form of international collaboration, that is a big problem, because the question you should ask yourself is that with all the time this would take to get approvals it needs, will whatever support or whatever collaboration that this individual be working on, will that be have the patience to wait for that period? Are we losing opportunities just because we don't have efficient leadership and reporting structures in place? And I know, again, these are mechanisms that were put in place a long time ago, and at some point, yes, they offer a very good check for different issues at different levels. But then the prescription here is to take a second look and redefine some of these roles and create a complete restructuring of these different levels of leadership and redefining the roles of these different levels of leadership such that it consolidates one or two positions that otherwise would have been performing just lesser forms of the same function to all be incorporated into one bigger function, which would actually reduce the wait times and the bureaucracy that's associated with decision making. So that's the first thing I want to talk about. The second thing is, as I said, we have all these mechanisms in place. Every government hospital would, at the beginning of every fiscal year, go through strategic planning, set strategic goals, and do everything that needs to be done in the beginning of the year to set up the institution for success. The one thing that has not been emphasized enough is that these strategic goals are not just theoretical exercises. These are supposed to be ongoing exercises. These are supposed to be revisited intermittently, whether it's quarterly, whether it's half yearly. These have to be revisited to see if the institution is in line with the goals that is set for the year. If it's financial goals, are you in line? If it's operational goals, are you in line with what you need to do? If it's about quality assurance issues, are you in line with the goals that you set at the beginning of the year? This has to be an ongoing process. What we see most of the time in these institutions is that once these very big, elaborate meetings are held in the beginning of the year and these goals are set, they do not go beyond that meeting. Now, everything at the end, in the course of the year, is just thrown into some form of autopilot, and whether it works or not, then that becomes a different situation. Now, do we have the structures in place to continuously monitor the progress of some of these goals and some of these strategies that we put in place? Do we stop at certain points to reevaluate those strategies if they are not working? Do we even know whether they are working or not? Now, our ability to continuously and consistently keep an eye on these goals is one of the biggest things that we need to do as a people. We look at these goals as our promise and our commitment to, one, the people that we serve, which are the workers who would in turn serve patients, and secondly, our commitment to the government or any other funding institution that supports the organization, and saying that anything that comes into this organization, by way of accountability, this is how we are going to manage this and make sure that they're properly used for the right purposes and to improve healthcare. Now, if we are able to put these mechanisms in place and have the right people to supervise them all through the year, it will do one of two things for us. One, it would provide an environment of continuous improvement and continuous learning, because then at certain points the institution is able to sit back and say, hey, we are not hitting these goals, and that is because we have not, probably strategy A or B is not working as effectively as we thought it would. So we need to look at how to tweak or adjust that strategy to be able to keep us back on track with what we need to do. So the second thing is that, yes, we set all these goals and we set all these objectives and we have all these strategies in place, but do we have the mechanisms in place to monitor them effectively and intervene when they are not working? Or we just set them up and allow them to play on their own all through the year, and at the end of the year we evaluate a process that wasn't closely supervised in the first place. The third solution is just on the workforce. Now, I made this comment when I talked about the challenges last week, but one of the things that we need to be paying attention to is workforce development. How are we recruiting people? How are we training these people? And especially, how are we retaining them? Because if we do not have very specific plans in place to be able to keep workers after we recruit and train them, if we do not have very specific policies in place to make them feel safe and cared for, and make them have the kind of attention that they need as people who offer essential services to the public, we will lose people and essential workforce in all that conversation. Now, one of the biggest things that I find difficult to appreciate is the fact that it actually costs the institution more money to recruit and train than it would to just put in measures to be able to retain people for the long term. What does this mean? So use the example of the health insurance and health coverage as an example. If I work in an institution which does not have a well laid out plan for me and my family and people who depend on me for when we are sick, and how we can access care within the facility, where the responsibility of the facility starts and ends, and where my responsibility as a beneficiary starts and ends, it is going to be a problem, because then I find myself giving everything I think I have as a trained professional to this institution, and I'm not getting the value of it back, because then even I think I have a headache and I need like a painkiller to give me some relief to go back to work, I probably have to pay for it in the same institution that I'm giving my everything for, and the institution that I believe I'm creating some form of profitability for. So the biggest thing that needs to happen here is that, do we have the plan and the policies in place to be able to make workers feel appreciated? Secondly, do we have a bonus plan in place? Is there a way to let workers understand that by virtue of the commitment that they are making to this institution, and if these metrics are met, they stand to benefit this kind of bonus or something from at the end of the year? Do we have those properly laid out? Because clarity is very important. I do understand that a lot of these institutions have very large events that they hold at the end of each year, and they reward a couple of employees. But based on what criteria? Is there clarity enough for people to really understand why some employees are rewarded and others are not? Do people have a sense of purpose and a sense of belonging and a sense of ownership when they come in, knowing that, okay, if I'm able to offer this quality of care and we're able to get our quality ratings up, the institution is going to reward me, whether it's financially or educationally, because other people just need some form of support to further their education and come back and help the institution. Are we well positioned to do that? If that is not what is happening, then we need to pay attention to the workforce. The third thing is just financial management and accountability. So unfortunately, just like every institution that we have in Africa and everywhere, financial accountability is very important, but the big part of this is failing because we do not have people who are just committed to being transparent and being accountable for some of the decisions they've made and the implications those decisions have had on the institution. So I'll give you an example, and one of the biggest challenges that we will have is just either intentional or unintentional financial mismanagement. Intentional in the sense that there's corruption. There are issues around corruption that we cannot discuss this issue without touching on. And unintentional in the sense that we put people who are incompetent into those positions, people who don't have the capacity to understand how to put the different pieces together to be able to have a very sustainable organization. So they tend to lose a lot of focus on what actually needs to be in place for that institution to be strategically well located or well positioned. So they do not know why they are losing money. They are not intentionally mismanaging it, they just don't have the competence to. But for those who have the competence to, some intentionally mismanage the financial state and everything that's in the hospital for their own personal gain. And these are issues that we need to move beyond. First, putting the right people in the right place, and secondly, holding these people accountable for the different challenges that this institution has. Holding them accountable for the success of these institutions. That's what needs to be done. Now, if we put all these together in the aspects of leadership, we put all this together in the aspects of making sure that we have more efficient resource allocation, making sure that we have human resources that we recruit, train, and retain with very well laid out strategies. If we put into place very good financial management and accountability measures in place, hospitals have the ability, with the volumes that we see, especially in government hospitals in Africa, to be able to raise internally generated funds so high that they would still need some support from the central government, but not as high as 60% of expense coverage coming from there, or philanthropists coming in to donate different items to support operations within the hospital. And if we're able to put all these together, the last bit of the strategy that we need to put in place in terms of how we can revamp our government hospitals and position as well is just making them more adaptable and making them more resilient, especially after the COVID-19 pandemic and everything that it costs a lot of healthcare institutions. The best healthcare institutions now are now putting measures in place to make sure they are well positioned for the next pandemic. They are well positioned for the next natural disaster. They have the financial savings to be able to support staff through those periods. They have the financial savings to be able to keep supply chain ongoing during those periods. They have the financial savings to be able to keep operations running during those periods. They have the savings to be able to take on more than what they're taking on now during this period. So again, these are things that I think, as I said, we'll be brainstorming on. These are things that we need to pay attention to. These are conversations that we should have beyond this platform. But this is my way of stimulating a conversation that we should be having we should have been having a long time ago, but it's important that we actually start having it now. So this has been another episode of the Think Clinical podcast. Thank you so much for joining me for this episode. And again, if you have any comments, any feedback, please leave in the comment section, and I'll be glad to engage with you. Do have a wonderful time, and remember, once again, subscribe, like, and share. I will see you in our next episode.